Hi, my name's Anirudh, and this is my project one. Um, this project had to do with the electronic medical record system for as our topic, and I chose to customize my project to monitor and track data in a dental clinic. So the database that I and set of tables that I um, implemented was for a dental clinic. So a dental clinic, they use electronic records like any other healthcare provider and service. The idea was that the clinic would see several patients a day, and I would track, or the database that I implemented would track the details of the patient themselves, their visit, and a lot of extra pieces of information like personal information, diagnostics, and diagnosis. And I chose to implement some extra features, which would include dentist info, reason for their visit, and dental clinic info, which, a couple things that I wanted to customize a project with was incorporate more information about the dental clinic, about medical supplies, and add some new features with billing information. And so, what really sets my project apart from others or from the examples that we were given was implementing different tables to complement the scenario that I envisioned. And so, with this time of COVID, essential activities that, that I was going to see, and it was a great time for me to think about the special aspects of a dental clinic when it came to cleanliness and PPE and things like that. So the scope was relatively small. It wasn't, on the scale of something like a hospital. It was, a very small. Dental clinics are usually a very small operation in comparison to things like hospitals, and so it was not that the size of my database wasn't as big. So it was just keep track of patient records, procedures, supplies like toothpaste, cleaning supplies, things like that, and dentists and dental clinic records. So I believe this is 9 tables that I incorporated was patients, visits, dentists, billing, supplies, diagnosis, dental clinic, reason for the visit, and personal information. So these were some of the extra parts that I included, which would be, for the patients, I included name, age, visit information, gender, and birth date. And so this was really, on the basis of providing basic information about a patient to the dentist. And the visit was another big part of my database, which would show, you know, why they came in, diagnosis details, and it shows a lot of symptoms and reasons why they came in, which is another table that I implemented. And so I chose to also implement a table for dentists, and these, dentistry was mostly a specialty, so I didn't choose to, add extra tables and extra pieces of data to elaborate on the dentists. They're really they inherit a lot of basic things like, the clinic that they work for, as well as their name, last name, and as well as their email and of their phone number for their clinic. And billing was another table that I chose to implement, which would it's very direct when it comes to and streamlined. So the billing would be directly related to patients, and then another table I added was supplies, and this was directly impacted with the dental clinic to keep track of a lot of supplies like gloves, masks, toothpaste, and a lot of chemicals that they use when having procedures, as well as diagnosis. And the last few were really simple. The dental clinic, this provided a more specific area by which dentists can show what clinic they work for, and addresses of different clinics and phone numbers. And the last two are very simple. The one was personal info that provided extra info on the patient and Another one, reason for visit. This was usually just a metric that was connected to patient IDs that just put a set of data that showed what the reason for their visit was. And these were my two diagrams. So on the left was my UML diagram, which shows how each table is connected to each other. You can see the most connected was probably the visit table. So visit table was connected by patients, reason for visit, diagnosis. It was also connected to dentists, and the dentists were connected to dental clinics, and supplies were connected to dental clinics, are associated with. That's a better word to use. And on the right we had the ER diagram, which was generated by MySQL, and this really gives you, after I implemented all the scripts, this really gives you all the fields and columns that were used and the relations between each table and etc. In the zip file that I included, screenshots of scripts that I used to populate the columns and fields for each table. So that's another thing you can look at. This is also just, breaking down all the tables when it comes to, the tables that I use. So this was all 9 tables that I implemented. And, each table was in a relationship with another by through association or inheritance. So, I wanted to split these up into what I thought were relevant tables for the scenario that I chose to implement. And of course, I used MySQL Workbench. This just broke down all of the tables with their special columns and fields, like I said before. And this just broke it up at the end. So that was mainly it for my database. If you want, we can also look at, what scripts I implemented. Oh, my bad. Sorry about that. Like I was saying, this is my PDF for all the queries that I implemented. So these were all mostly update queries. We had to have a total of 10 different queries that really showcase the relationship and functionality of my database. And so these were, different queries that I used that used, joins and used different parts and concepts that we learned throughout the course to, update and track different pieces of data on the table. So that was pretty much it for my talking about my database. I hope you have a good time, exploring and seeing what my database has to offer. Thank you.